My name is Pearlman. I'm a pediatrician in Miami Beach, and I take care of children from birth to about 23, 24 years old. The basic sciences is where studying for this job begins, and learning about organic chemistry, biology, and then we kind of go into human anatomy and physiology to really focus our interest, but also learning about how medications work on the body. So physiology becomes really important, and then psychology, obviously, because there's medications, but there's also understanding people and how they respond to being sick or having to take and be treated with medications. We see patients in mostly an outpatient clinic setting, and so I see about 25 to 30 patients, and I see them when they're well, I see them when they're sick, make sure that they're growing, make sure that they're eating well, they're sleeping well. These are all things that make sure that they are well and thriving. I do 4 years of undergrad where we do basic sciences but also liberal arts education, and then medical school is another 4 years. The first 2 years are in a classroom setting, and the second 2 years are in a hospital where you're actually interacting with nurses, other physicians, patients. And then we do residency in pediatrics. We do 3 years where we're rotating through different parts of a pediatric hospital. We see general pediatrics, but we also see kids in the ICU, in the ER setting. Math is something that we use all day because, especially in pediatrics, kids have different doses that are based on their weight. So every time I prescribe a medication, I have to calculate it based on how much they weigh and how many times a day they're using it. And so that's something that I use all the time. So we used to always use paper and handwriting and indescribable, indecipherable notes. These days, thankfully, a lot of it is in a computer where we're typing and we're trying to communicate with each other. The hope is that with technology that doctors will be able to work with nurses and with other doctors and with patients a lot more effectively. Telemedicine is the future in the sense that if you are coming or treating people in a remote place, you can really do your work, maybe not completely, but very close to what you can do if they were there in front of you in person.